I'm Dr Charlson of clinics in London and Yorkshire. I'm going to talk to you today about the tear trough or periocular area around the eyes, that dark panda eye appearance that we see in many patients. And that's because I get many patient inquiries. The first thing to say is it requires a proper assessment because some patients are just not suitable for any non-surgical technique and require a lower blepharoplasty if their skin's loose and there's perhaps some fat herniation and loss of rigidity of the ligaments in this area. But many patients, you can do something for them. Hyaluronic acid fillers are often used. However, you've got to be quite careful with these because they can have almost like a sponge-like effect, sucking in moisture and causing swelling, which doesn't necessarily come on immediately, but can last a long time. So you have to choose those patients quite carefully, and I'm doing less and less hyaluronic acid fillers in this area because of that. Another treatment I use quite a lot is Juvelook, which is a poly-D-lactic acid, small particle, which can be used in this area. And this creates a collagenization in the area, tightens the skin, and improves fine wrinkles in the area, and sort of fills it out very slightly. You need more than one treatment, probably 2 or 3 treatments, but you get some really quite nice results with that, provided the tear trough isn't too deep. A deeper tear trough, I can use what we call an autologous treatment, where you take blood and you produce something called biofiller, and a biofiller will fill out that area. And also I mix this with some platelet-rich plasma, which we use during the preparation to create a rejuvenative effect. Biofiller doesn't last as long as a dermal filler, but it's really quite a nice product. It's very safe, and used with the rejuvenative PRP can be really very good in the longer term. Another blood-based product I use is PRF, platelet-rich fibrin, which again can fill out the area really nicely. Usually requires more than one treatment, but is really quite safe and a nice treatment for the area. And lastly, we use device-based treatments, and one of them I like is Tixel in this area. This is a heat-based instrument which creates a collagenization and again tightening of the skin. So there's a whole range of treatments that we can do. We can also address the pigmentation in this area with various other products such as Clardy Ruby. But it's a complex area to treat, not simple, and that's why you see lots of people saying, I've had tear trough treatment, it doesn't work, or whatever else. And that's probably because it wasn't the right treatment for them. So I think it's really important you come for a proper consultation, a proper assessment, and discuss the options, as one option for one person might be different from someone else. I hope that's helpful. Thank you very much.